So what's more of a risk factor is how you live your life than who you were born to. So genetics and heredity is 1 to 2% of the risk factor. Lifestyle is more of a risk factor. So we're keeping it simple, right? So now we're on M. You want to manage your medications and you want to manage your comorbid or co-occurring medical conditions. Medications can fight against each other, especially if they don't agree with each other, and it could cause memory loss. It could cause confusion. It could cause disorientation. And what I don't want you to think, I don't want you to think that if your loved one is experiencing confusion and memory loss and forgetfulness, that they automatically have dementia. It could be because they're having some issues with their medications. A lot of our seniors have more than one doctor. They have a doctor for as their primary care doctor. They have a specialist for their urinary tract issues. So they may have a urologist, they may have an oncologist, they may have a gastrologist. So gastroenterologist. So they have all these different doctors prescribing different medications, but no one is reconciling those medications to make sure that they're not harmful to each other, ultimately harming the person. So you want to be sure that you and your loved one, all the medications that they're taking, including over-the-counter medications, that the primary care doctor is aware of it, and the primary care doctor can say whether or not those medications are fighting against each other. Also, the pharmacist can tell you if the medications are fighting against each other. So that's called a medication reconciliation. You want to do that for you as a caregiver, but you also want to do that for your loved one who's experiencing memory loss or forgetfulness. Managing your comorbid or co-occurring conditions, your chronic illnesses. High blood pressure is a chronic illness. High blood pressure, if not treated, can lead to Alzheimer's or other types of dementia. So you want to be sure that your pressure is where it needs to be for you. Now, everybody's pressure is not the same. Now, the American Heart Association says it should be 120 over 80. My blood pressure ain't never been 120 over 80. It's never been 120 over 80. So for me, what's normal for me is low 130s, high 80s. That's what works for me. And the reason I know that works for me is because I have a record of it with my primary care practice. So you want to be sure that your loved one sees one doctor for their primary care doctor, and all the specialists are talking to that primary care doctor. You as a caregiver may have to be the intermediary to ensure, and the liaison to ensure, that the primary care doctor has all these medications that these specialists are prescribing to ensure that they're not fighting against each other. You want to be sure that your blood pressure is where it needs to be, your cholesterol is where it needs to be, so that way it reduces your risk of developing other co-occurring conditions that increase your risk of developing Alzheimer's disease. Obesity, if you're overweight, that increases your risk. If you are dealing with diabetes, you want to be sure to get that in control. You want to be sure to have what you need in order to manage it as best as possible. That could be with medications, that could be with insulin, it could be with diet, right? And I don't mean diet like you're going to diet. I mean like your meal plan, what you're eating. So be sure that your diabetes are managed, because it can increase your risk of developing Alzheimer's or a progressive type of dementia. So we went to SEM because we're keeping it simple, right? But with an E. P, play games. I don't mean mind games. I don't need y'all playing mind games with anybody. But you want to play games against the clock. When you play games against the clock, you are building a cognitive reserve. You're working those neurons. If those neurons and those neurotransmitters are not working, then they die out, right? If you don't use it, you lose it. That's with your brain as well, right? So you want to play games against the clock. You want to play musical instruments. If you know how to play the piano, or if you know how to play the guitar, play that, right? Learn to play a new instrument as well. that keeps your mind going. It keeps you engaged. It keeps those neurons firing off. And also too, when you play music, music makes you feel good, right? And when you're playing, the piano and you're playing these songs and the keyboard, it's making you feel good, right? So you're actually addressing several components of your overall well-being, right? It's making you feel good. So you're tapping into your emotion. It's tapping into your behavior because you're smiling, you're engaging with other people. You're getting into it because you're doing this, or you're doing that. So you're physical, right? And cognitively, you got to remember how to do this stuff. And so when you're playing music instruments and playing games against the clock, you are engaging your full well-being, which can reduce your risk of developing Alzheimer's or a progressive type of dementia. We're keeping it simple, right? All right. L, lifelong learning. You have to be a lifelong learner, which means you don't stop learning because you've graduated from school, you've obtained your degree. That's not where it stops. Actually, that's where it starts, because you want to continue to engage your brain. You want to continue to learn new information. Again, it's firing off those neurons. You're building a cognitive reserve. So if you were to develop Alzheimer's, then you could stave off or severely delay dementia, because you have developed a cognitive reserve, because you have been engaging your brain. And lastly, keeping it simple, right, with an E, engagement, social engagement. You want to be sure that you're staying engaged with other people. I know that you can play games and talk to people and engage with people online through social media and things of that nature. That's good, but that ain't good enough. You want to be sure to stay socially engaged with other people. We are social beings. We are beings with feelings and emotions, right? And so we want to be able to give that, but we also want to be able to receive that, right? And so again, you want to be sure that you're engaging the full domain of your well-being. That is your emotional health. That's your cognitive health. That's your behavior, right? You also want to ensure that you are at the point where you know that who you're around and what you're doing is not stressing you out. Because if you're socially engaged with people and they're getting on your nerves and they're stressing you out, that's counterintuitive. That's defeating the purpose of, why you're in their presence anyway, right? So we're talking mind, body, behavior, emotions, the 4 domains of your overall well-being. That is how you can effectively reduce your risk of developing dementia or Alzheimer's disease. I'll tell you, I have had a lot of caregivers say to me, not men, but women caregivers say to me, am I going to get Alzheimer's disease because I'm taking care of my mom, or I'm taking care of